So next I'd like to introduce Janet Freeman-Daily. Janet is a metastatic lung cancer patient in a precision medicine clinical trial. She uses her writing and her speaking skills along with her engineering degrees to translate the experience and science of lung cancer. Janet?
I apologize for having to use notes, but my chemo brain kicks in at the most inconvenient times. So, as you heard, I am a metastatic lung cancer patient. I'm alive thanks to research, precision medicine, and patience. My lung cancer journey is a good example of the importance of research, hope, engaged patients, and patient advocates. I was diagnosed with advanced lung cancer in May of 2011. I never smoked anything except the salmon. Thank you, thank you. My primary lung tumor and lymph nodes all responded to concurrent chemo and radiation. 2 months later, a scan found a new hot spot on my collarbone. And in the next 3 months, it grew to a 3-inch tumor. But I wasn't just a recipient of care. The information I learned in online patient forums helped me to become an interactive participant in my care. From other patients, I learned about more extensive molecular testing, asking for my data, and clinical trials. I was able to arrange to have my slides sent to the University of Colorado for more extensive testing. Unfortunately, all the tests were negative. I had more chemo, followed by more radiation. A new scan showed all the known tumors were shrinking or dead. But I had 2 new tumors now in my other lung. Every time I stopped treatment, I progressed within 2 months. My oncologist said I would be on chemo for the rest of my life, which would be short. However, another online patient told me about a driving mutation called a ROS1 rearrangement. It was very new. The journal article had just come out. He sent me that journal article, and I shared it with my doctor. And after my second progression, I contacted the University of Colorado again. And they had just developed a test for ROS1. They found I had the mutation. I joined their clinical trial. And thanks to precision medicine and online patients, I have had no evidence of disease for 34 months and counting. I am not cured, but I am living well with lung cancer. I chose to show my gratitude by becoming a patient advocate. Lung cancer is the #1 cancer killer and the second leading cause of premature death after heart disease. My goal is to improve outcomes for lung cancer patients. My primary focus is to inform and educate through my writing, blogging, participating in online patient communities, and collaborating through lung cancer social media on Twitter. Online, I found patients with my type of lung cancer on the same treatment who understood exactly what I was feeling and experiencing. From online patients, I learned how to cope with treatment side effects, ask for my data, and find reliable information about genomic testing, treatment options, and clinical trials. Online communities gave me hope. We e-patients are not just people who search for health information online. An e-patient is any patient who is equipped, engaged, empowered, and enabled. These patients can become equal partners in their care and can work to improve outcomes. If I had not had access to other e-patients, I would be dead now. Another focus is educating healthcare providers about patient needs and shared decision-making. Successful compassionate treatment of life-threatening illnesses like cancer require more than just scientific evidence and clinical judgment. Knowing patient values and preferences and considering them in shared decision-making process is essential for good quality of life and desirable outcomes. We need to encourage healthcare providers to ask patients what they value and encourage patients to tell providers their preferences. My third focus is on improving the flow of data and patient navigation in the healthcare system. Healthcare is a complicated place, especially for patients with chronic or life-threatening diseases. Fax machines and data CDs are still the only way to get data from one healthcare system to another. Acute and chronic patients often have several specialists in different physical locations and even in different healthcare systems. The task of care coordination usually falls to the patient. We need better ways to coordinate patient appointments, update patient status for all caregivers and providers, facilitate efficient communication in a crisis, and ensure smooth transitions between healthcare facilities. We need true connected health. A big focus for me is dispelling the stigma of lung cancer. Lung cancer kills more people every year than the other top 3 cancers combined, yet it receives less federal funding per death than any of them. Why is that? Are lung cancer patients not worth saving? Well, the answer becomes clear when you Google the words lung cancer people. No throngs of ribbon supporters, few smiling survivors. You see damaged lungs, death, and cigarettes. Lung cancer has an image problem. When I tell people about my disease, the first question I get is, did you smoke? People blame patients for getting lung cancer. The breast cancer community has successfully changed the way people see their disease. Lung cancer needs to do the same. Now that more patients like me are living longer, we are using social media and our voices to speak up and fight the stigma and raise awareness about other risk factors such as radon, workplace exposure, air pollution, and simply aging. Another more recent focus is informing patients and doctors about molecular profiling tests and treatment for cancer. There are now over 17 actionable lung cancer mutations which enable patients to receive either approved drugs or enter clinical trials. Metastatic lung cancer patients are still being sent home on hospice without getting these tests because doctors and patients don't know about them, even though they're in the NCCN guidelines. In addition to informing patients and providers about this, advocates are involved in policy discussions to talk about patient ownership of their tissues, genomic testing and medical device regulations, value in cancer care, and the cost of new drugs. Patient advocates are also helping to design, review, implement, and fund cancer research and new evidence-based treatments. A group of lung cancer patients helped change the NCCN guidelines for metastatic lung cancer. The Addario Lung Cancer Medical Institute, which is a patient-driven nonprofit, designed and funded a clinical trial of young lung cancer patients using remote enrollment. As a patient advocate for the NCI Lung Cancer Spore at the University of Colorado, I initiated a study where we are collecting deceased lung cancer patients' tissues and moving them into an NCI research biobank. Patients are helping to design healthcare and improve outcomes with professionals and industry and healthcare providers. We're working to identify patient needs, design clinical trials for faster accrual, inform government regulations, and pursue increased research funding. We are making a difference. Thank you for listening to the patient voice, and I hope you include it in more future endeavors.
Thank you, Janet. Thank you.